Hello, I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation. Every Tuesday evening, 6 p.m. Pacific Time, we have the Ask Dr. Barkin call-in show, and part of the program is that we review certain article, and I'm going to discuss now one of the abstracts of these articles. It was discussed on May 25th, 2010. Let's go now to the article. The name of the article is A Holistic Approach to Androgen Deprivation Therapy, Treating the Cancer Without Hurting the Patient. This was published in the Urol International 2009, volume 83, pages 373 till 378. So let's first go ahead and look at the abstract. In the abstract, as we could see, androgen deprivation therapy for advanced prostate cancer. And I want to stress here that advanced prostate cancer can be associated with side effects which may negatively impact quality of life and induce serious medical problem. This is a very important point because the recommendation here is to give it only to patients with advanced disease, and we know there is a tendency to give it to patients with earlier disease. Also, that it's not only a question of side effects and quality of life, there are some serious medical problems. The aim of this article was to give practical recommendation. The stress is on practical recommendation on how to monitor and counsel patients and effectively manage side effects based on relevant original articles, reviewed article, and abstract. This is a good article which I recommend every doctor or patient involved in starting hormonal blockade to use the points here as a starting point to discuss how to manage in a proactive way the issues of being on hormonal blockade. Let's go now to the specifics of the side effects and the points really highlighted in this article. First, let's go to the hot flashes. Hot flashes are defined as a sudden, intense, and uncomfortable heat sensation in the face, neck, and the upper part of the body. It's triggered many times by stress, by sudden changes in body position, or ingestion of warm or spicy food, or smoking. It's amazing to find out that this complication affects actually 80% of the patient. The second side effect is sexual dysfunction. Obviously, lower testosterone brings to lower libido, and this is not satisfying to a patient to be told just hold hands and come close, but this is important. The intimacy is an important part of it. Some physicians are trying even to treat it by giving intracavernosal shots, but even if you take medication, the testosterone is still needed. I think the best way to help the patient is to try not to put him on hormonal blockade in the first place if it's not indicated, especially if it doesn't have advanced stage. And number two, try to shorten the period of time. And number three, perhaps to move away from deprivation of testosterone and treat the patient only with Casodex and Proscar or Casodex and Avodart, which will leave the production of testosterone in the body but block the entrance of testosterone into the prostate cancer cells. Let's go now to the third complication, which is fatigue and impact on quality of life. This is the most common side effect, and the recommendation in this article and otherwise are that the patient should really increase his physical activity to strengthen the muscles, and that was found in some studies to really help with the problem of feeling fatigue. Also, you need to check on the hemoglobin to make sure the hemoglobin is not low. The fourth side effect, psychological side effects, there is no question that you hear it from patients all the time that they have some reduced cognitive function and emotional instability, and I say that the doctor has to weigh between this side effect and the need to be on hormonal blockade, because in some patients, especially young, it is very difficult for them to have this emotional instability, at the cost sometimes of switching the treatment or modifying the treatment as discussed above. The next complication is the induced bone loss. Several studies have shown decrease in bone mineral density, and there are actually some recommendations to do bone mineral density before starting hormonal blockade and also periodically after that. Now let's talk about one of the side effects which is really important, is the metabolic and cardiovascular side effects. These are not a question only of quality of life, but also may affect life itself. So there is increase in subcutaneous mass, there is increase in fat, there is increase in high density cholesterol, and increase in adenopectin levels. One of the causes that they really create in the body is the insulin resistance and tendency to develop diabetes type 2, and this is a very important point. From the practical point of view, there is important for the physician to be aware of it and take some steps to monitor it. For example, take the blood pressure, take the circumference of the abdomen, and measure the blood test for cholesterol and lipids, and measure the insulin and the glucose level in the blood too. How do we prevent the side effects? It's really highly recommended to avoid the osteoporosis of bone loss and let the patient feel better, is to try to do exercise, but not only aerobic exercise, but do resistant exercise that will make the patient feel better, make the bone stronger, and overall improve the cardiovascular ability of the patient. There is in the article a checklist for monitoring the patient receiving ADT table 3, and I highly recommend this article to be read by patient and doctor alike. Thank you for listening. I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation. Those of you who want to join us and listen to Ask Dr. Barkin call-in show, you could call the following number: 1-877-727-3301, and either join us every Tuesday 6 p.m. Pacific time on the phone, or get on our website www.pcref, we stand for Prostate Cancer Research Education Foundation.org, and you could listen to audio streaming of the show. And if you miss the show, you could download it from our website to iTunes and to your iPod. Thank you for listening, and I want you to know that the phone line 1-877-727-3301 is open 24 hours a day, 7 days a week, for you to call in between the show and record any question you might have about prostate cancer and men's health. Thank you for your attention. Have a good day. Bye-bye.